I'm going to be performing my skill of an indwelling urinary catheter into a male patient. The first thing I'm going to do is verify my provider's orders with my correct patient. Next, since I have a male patient, I'm going to review the medical records to make sure there's nothing that could hinder the procedure, like having prostate cancer. The next thing I'm going to do is perform hand hygiene, knock on my patient's door, introduce myself, make sure they have patient privacy, identify them with 2 patient identifiers, the name and the date of birth. I'm going to explain the procedure, make sure they agree. I'm going to let them know that we are inserting an indwelling urinary catheter into their urethra and into their bladder. The next thing I'm going to do is I'm going to palpate their bladder for any distension. Next, I'm going to wash my hands. I'm going to apply clean gloves. I'm going to raise the bed for a good working position and lower the side rails as well. Make sure my patient's comfortable. I'm going to make him be in a supine position. I'm going to make sure there's a waterproof pad underneath him. And I'm only going to expose the area I'm working with, so I'm going to put a drape over the top of area and then make sure there's a blanket on the bottom part. I'm going to provide perineum care with water, soap. I'm going to wash all around it from dirty to clean, and I'm going to dry it off. While I'm over here, I'm going to identify the urinary meatus, and if they're uncircumcised, pull back the foreskin. Once I have it all clean, I've identified where I'm going to be inserting the catheter, I'm going to take off my gloves and I'm going to wash my hands. I'm going to make sure there's a trash can nearby. This is a sterile procedure, so I'm going to take this and open it without crossing the sterile field at all. So that's open. I have my everything on top, and I'm going to keep it next to my sterile field. You don't want to cross it at all. The first thing I'm going to do is I have my sterile gloves. I'm going to open it without touching the inside at all. I'm going to grasp the outside of the cuff and guide my right hand in there without touching the inside at all. And with my 2 fingers, the inside of this cuff to the outside part, and guide in my non-dominant hand. All right. And I'm going to only touch the sterile part of this, and I'm just going to toss it. The next thing I'm going to do is, without really touching this perineum drape, I'm just going to try to let it open by itself. And then just touching the outer edges, I'm going to drape it over the penis. The next thing I'm going to do is I'm going to get my iodine swabs, and they're already soaked in this solution, and I have 3 of these, and then we're going to do it 3 times in a circular motion. Clean it from the urinary meatus outwards in a circular motion. And every time you do it, you want to get a fresh, clean one to keep the sterile field 3 times. Okay, now that I've cleaned the area with the iodine solution, I'm going to get my lubricant and put it in my sterile field. And I'm going to get my catheter. And I am going to dip the catheter in the lubricant. Next, I'm going to, with my non-dominant hand, I'm going to hold the shaft of the penis, and 3 to 4 inches, I'm going to, in an upward motion, insert it. I'm going to tell the patient as if they're going to void. And then I'm going to keep going 7 to 9 inches about until urine comes out of the catheter. And I'm going to make sure I have a sterile container, urine container as well. All right, once it's 7 to 9 in, well, since this isn't a real patient, I need to tape this because it's not going to stay in here unless I do. I'm going to release the penis of my non-dominant hand, and I'm going to hold the catheter, and I'm going to blow up the balloon with my syringe solution as much as is recommended or ordered. And then once that is blown up, I'm going to release the catheter, and I'm going to gently pull until there's some resistance, and then we know it's good to go. We can take the syringe off. We can perform any hygiene that is needed, cleaning the patient off. Throw away all my supplies, and I'm going to remove these gloves now. I'm going to wash my hands. I'm going to get clean gloves. And we are going to want to make sure the catheter is secured to the thigh. The inner thigh, make sure there's not a lot of slack for tension, so they can move around pretty easily, and that it won't be pulled on at all. All right, and now we are going to attach the bag to the side of the bed. And then any excess coil, we're going to coil it up and attach it to the side of the mattress. I have nowhere to hook this, but we would make sure that it is lower than the bladder. All right. I'm going to make sure, I would throw this away, but I had to attach the tape to it on the leg, so I can't throw that away. I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to I'm going to raise the side rails, lower the bed, make sure my patient is in a comfortable position. Also, I'm going to make sure there's no kinks on the tubing or any obstructions. Make sure my patient is comfortable, and I'm going to give my patient teaching, letting him know he needs to keep the area clean at all times and no pulling of the catheter, and I'm going to ask him to repeat that back to me. I'm going to go wash my hands again, and I'm going to look at my urine bag, and I'm going to record the input, output, and observe for the characteristics. And I'm going to go back, wash my hands. I'm going to document the response and the expected or unexpected outcome that I had from my patient, and should be good to go.